So moving on to need for diagnosis, because that's something that I come across a lot as a professional, with parents saying, doesn't my child need a formal diagnosis of something like autism or ADHD? My response to that would be that some children, some young people may benefit from a diagnosis, but lots of them don't necessarily need a diagnosis. I think it's really important to recognise what that young person's strengths are, as well as what their needs are, and then look at what can be put into place wherever they are. Supporting school colleagues with that, and also parent carers if they've got some challenges at home. What do you feel about that as a parent, Rachael?
I think sometimes you have to think as well that the child may not want a diagnosis, maybe now or maybe when they're older, so you could be affecting the course of their life, couldn't you? So it is about the school meeting their needs, isn't it, and whether they can do that or not. I think sometimes parents worry that maybe they might not get any HCP for their child if they haven't got a diagnosis. So it's also about whether or not you need any HCP to be supported. These are all important conversations, aren't they?
Absolutely.
Yeah, and I think it's really important that families understand that not having a diagnosis should not be a barrier to receiving the support that you need at the right time. It shouldn't be about receiving a label. It is about identifying need. And I think, Rachael, you said something really important. It is also about that choice. Because for some young people, having a diagnosis can actually limit some of their future choices and options. So I think people need to have that information early on. And maybe a diagnosis isn't needed in the earlier years, but perhaps it'll become more necessary later on. It can also open doors. So different times will be right for different people. Absolutely.
It's all a process, isn't it?
Yeah.
It's all about moving on through the years.
Yes, yes.
Yeah, and the young person really understanding the implications of it, as Stuart said, and giving consent if they want to continue with that process. And I've worked with some young people where, they've really wanted to pursue a diagnosis because it makes sense for them, and other young people who absolutely don't. And that's fine, isn't it? That's what the young person or child wants.
And I think one of the other anxieties that as a parent care forum we often hear from families is, will their child get the support they need if they don't have any HCP? And from a local authority perspective, what would we be saying to families who are asking that question?
Well, schools and settings should be able to meet the needs of any child or young person by putting into place reasonable adjustments. And Rachael talked about some of those earlier, so it might be a soft start to the day, it might be having fiddle toys to help them to concentrate, it might be leaving lessons early so that they can avoid the melee on the corridors, or perhaps having a different lunchtime. Lots and lots of things we can put into place, as well as things like assistive tech. So when parents ask me that, my response would be, well, is an EHCP going to change your child? You've still got the same child or young person there with all of their strengths and some of the areas that they find a bit more challenging. So I would hope that all schools or settings could meet needs without having to put in place an EHCP. And of course the other thing is that EHCPs do not necessarily come with any funding, or they come with a very small amount of funding. So realistically, your child may not get much more support or any different support than they're already getting if we've got an inclusive school.
So the aspiration is that wherever possible we could meet the needs, or we should be meeting the needs of children and people with additional needs in their setting without an EHCP, with the right support, with reasonable adjustments, perhaps some additional funding to meet those needs. But we're also not saying that that will be the case for everybody, are we? There will still be some children and young people who will still need an EHCP to meet perhaps more complex needs in the right setting.
Absolutely, it's about level of need, isn't it? And some young people have a very high level of need that might need a lot of additional funding or a lot of flex around reasonable adjustments. So for some of those families, there may be a need for an EHCP, but certainly not all families and all young people.